The aim of this video is to show you how to use your own hand to understand its anatomy. I want to thank my teaching colleague Cynthia Tang for allowing me to use her hand and forearm for this video. So we're now looking at Cynthia's right hand, and we're going to learn the surface anatomy of the hand, but also learn more than the surface anatomy, some of the anatomy of the hand, and you can do this yourself looking at your own right hand, perhaps while you watch this video or after you've watched this video. If we look now, we want to see where the three joints are. There's a distal interphalangeal joint, which is level with the hinge joint. Just bend your finger there, Cynthia, thank you. There's a proximal interphalangeal joint, and there's a metacarpophalangeal joint, but the metacarpophalangeal joint is here. So if Cynthia bends her hand like this, note that when we turn her hand to the side, that's the axis of the joint. Here's the head of the metacarpal, here's the base of the proximal phalanx, and if that's the point of the joint, you'll see it's here. So don't think that the metacarpophalangeal joint is here, it's here. Similarly, this is the crease for the wrist joint here. And this is the radiocarpal joint. The carpal bones, the 8 carpal bones, are all distal to this line. So we're now going to look at the extrinsic tendons that come down and pass across the wrist joint, being extrinsic going from the forearm to the hand. There are 3 wrist flexors, and I'll explain why I say there's 3. If you could put your thumb and your little finger, bend up against me. This is palmaris longus, which not everyone has. Now if you make a fist, bend your wrist up against me. This tendon here going to the base of the thumb is flexor carpi radialis, and you can't see it, but you can palpate a tendon here which is flexor carpi ulnaris, going to the pisiform bone. So these are the 3 wrist flexors. Flexor carpi ulnaris being on the medial side, palmaris longus being central, and then notice that flexor carpi radialis is almost central too. Don't think that flexor carpi radialis is down this side, because remember it's coming from the medial epicondyle. The reason I call these 3 wrist flexors is that I include palmaris longus as a flexor because when we get around the extensor side of the wrist, we'll find there are 3 wrist flexors, extensors. So I like the style that there are 3 flexors and 3 extensors of the wrist. I like the symmetry of that. We come now to the carpal bones. The 8 carpal bones are here. And there's 4 that are important when you're talking about the tendons that pass from the forearm to the hand. And you can palpate this in your own hand. Just here is the pisiform bone, which is a sesamoid bone in flexor carpi ulnaris tendon. Just distal to that, if you feel and palpate firmly here, and I've got it there, that's the hook of the hamate. And if you go over here, there's the tubercle on the scaphoid, and then distal to that, a bit deeper and harder to feel, is the ridge on the trapezium. So these are the 4 pillars of the flexor retinaculum. So notice that the flexor retinaculum, which covers over the carpal tunnel, is all in the hand. It is not in the wrist. Just to repeat, the 4 posts are the pisiform bone, the hook of the hamate, the tubercle on the scaphoid, and the ridge or crest on the trapezium. And note that the flexor retinaculum is about the size of a postage stamp. It's quite small. Under this ligament, where the carpal bones curve, are concave facing this way, there is a space called the carpal tunnel, and 9 tendons and the median nerve pass under this ligament. The word carpal just means wrist. The most important structure passing under the flexor retinaculum through the carpal tunnel is the median nerve, and it lies between palmaris longus and flexor carpi radialis, and it passes through the carpal tunnel. The ulnar nerve doesn't pass through the carpal tunnel. Its undercover flexor carpi ulnaris stays on top of the flexor retinaculum, goes up to the hook of the hamate and divides into a deep branch that curves across the palm and a superficial branch that goes down to supply 1.5 fingers. Note that the median nerve goes right through the carpal tunnel. The ulnar nerve does not go through the carpal tunnel and goes through a little superficial tunnel here called Guillon's Canal. There are 9 tendons passing through the carpal tunnel. The first one that everyone forgets is flexor pollicis longus, which comes down here, goes under and swings round to go to the thumb. There is only one tendon in the thumb and it flexes the end joint, the interphalangeal joint of the thumb. Remember, the thumb has only 2 phalanges and has an interphalangeal joint and a metacarpophalangeal joint and has only one long tendon, the flexor pollicis longus. In some people, you can test the flexor pollicis longus to see if it's intact by just relax here, by just gently pressing here. Notice Cynthia's distal joint of her thumb is moving when I press. So that's to remind you where flexor pollicis longus arises from the radius to go to the thumb. There are then 4 superficial tendons, 4 flexor digitorum superficialis muscles, and they're individual muscles and individual tendons, and they go through under the carpal ligament to go to the 4 digits. And you may remember that they go through the carpal tunnel like that. The 2 central flexor digitorum superficialises to the middle and ring finger are anterior, and the 2 lateral ones either side, the index and the little finger, are more posterior. So this is flexor digitorum, this is flexor pollicis longus, and the 4 tendons of flexor digitorum superficialis. Deep to the 4 superficialis tendons of the flexor apparatus, flexor digitorum superficialis's 4 tendons, is the flexor digitorum profundus. And the important thing about that is, apart from it having a dual nerve supply, that it is actually one tendon, one thick, broad tendon, not 4 tendons when it's coming down to the carpal tunnel. And then the first tendon to come off it is the index tendon. And then the other 3 come off. But remember, it is one mass tendon coming down to the carpal tunnel, and then in the carpal tunnel, and it varies from person to person, it divides into the 4 tendons to go to the 4 digits. It's important to understand where the 2 flexor tendons, that's the profundus and the superficialis, insert in each finger. The profundus tendon is deeper and the superficialis tendon is more superficial in the palm and the forearm. But in the hand, the superficialis tendon, which is the more superficial one, splits, and to allow the profundus to go through to become more distal. The profundus, flexor profundus tendon inserts into the base of the distal phalanx, just here. The flexor digitorum superficialis has a very big insertion onto the whole front of the middle phalanx. That's important clinically because you can rupture the profundus tendon off the base of the distal phalanx, but you can never rupture the attachment of the superficialis tendon along the front of the middle phalanx. Now, these 2 tendons have a different function. Clinically testing, if I get Cynthia now to bend her distal interphalangeal joint, push it out straight, she's using her profundus. And you'll notice when she goes to do that, do it again, Cynthia, you'll notice how these fingers are moving a little bit. Now, if I want to test her superficialis tendon, bend it here. It only flexes the proximal interphalangeal joint. Bend down real hard. And notice that the profundus tendon has no effect. The reason the profundus tendon has no effect is it's a mass muscle with one tendon, and you'll notice that I'm pulling Cynthia's index, middle and little finger profundi out straight. So by pulling this out straight, I've made the profundus inactive in this finger, and the only tendon that is flexing the ring finger now is the superficialis tendon. So just to repeat, the profundus tendon inserts into the distal joint and can flex the distal joint, bend there. The superficialis tendon inserts beyond the middle joint into the middle phalanx, and if I hold the profundus stretched out in extension, bend this finger, bend it down hard, the superficialis tendon is flexing the proximal interphalangeal joint, but it's having no effect on the distal interphalangeal joint. This is something you want to try on your own hand. And Cynthia will now flex this joint, right up. The middle finger, no, sorry, just bend it at the proximal interphalangeal joint. The next one, the next one. So this, the superficialis, gives you individual finger flexion. An individual finger flexion is hugely important in using the keyboard and every musical instrument. The profundus inserting into the distal joints is a more mass action muscle and doesn't give you individual finger flexion. And therefore the superficialis flexing the proximal interphalangeal joints gives you individual finger flexion. Just go through it. Each finger can flex individually, and every musical instrument and all keyboard, computers, but not texting, depends on individual finger flexion. That's why we have a superficialis tendon. A good way to revise hand anatomy is to realise you have a distal palmar crease, and that's actually the junction of this crease and that crease. And if you draw those together, this is your distal palmar crease, which is where the metacarpophalangeal joint is. And a whole lot of things happen at the distal palmar crease. It is where the metacarpophalangeal joint is, and it's where the digital nerves, the common digital nerves and arteries, divide. So from the ulnar nerve here, or from the median nerve here, the common digital nerve becomes the digital nerve proper at that line. Both the arteries and the nerves divide at that line. The flexor mechanism with the profundus tendon going all the way to the distal joint, the superficialis going to the middle phalanx, is all within a fibrous sheath. And the fibrous sheath binds these down, and the mouth of the fibrous sheath is at this line. We come now to the dorsum of the hand, and there are many extrinsic tendons here passing from the forearm into the hand, and they're in 6 compartments. The 6 compartments are created by the extensor retinaculum, which is here, and the tendons run through these compartments, and we'll just go through the tendons. In the first compartment are 2 tendons here. This is abductor pollicis longus and extensor pollicis brevis. That's the first compartment. They're both going to the thumb. Pull your thumb up hard now. And this is the third compartment, which is extensor pollicis longus. So these are 3 thumb tendons, and it's the first compartment has 2 and the third compartment has 1. The reason I've jumped across the second compartment is you can't see the tendons in the second compartment. These are 2 wrist extensors, the extensor carpi radialis longus and extensor carpi radialis brevis. And they actually insert into the base of the second and third metacarpals, and therefore don't really go right through a long tunnel and come out the other side. So there are 3 wrist extensors: extensor carpi radialis longus, extensor carpi radialis brevis, and in the 6th compartment over here is the extensor carpi ulnaris. So you remember I said there were 3 wrist flexors: flexor carpi ulnaris, flexor carpi radialis and palmaris longus. Similarly, on the back of the wrist there are 3 wrist extensors. So we've now done 3 tendons to the thumb. And it's quite neat where these insert. Abductor pollicis longus goes to the base of the metacarpal. Extensor pollicis brevis goes to the base of the middle phalanx, the proximal phalanx, and extensor pollicis longus goes to the base of the distal phalanx. So these tendons 1, 2, 3, going to the thumb, insert 1, 2, 3. So there's some symmetry there. The abductor only goes to the base of the metacarpal. The extensor pollicis brevis goes to the base of the proximal phalanx, and the extensor pollicis longus goes to the base of the distal phalanx. So we've done the 2 tendons in the first compartment, the 2 tendons in the second compartment, the 1 tendon in the third compartment. You'll notice this tendon extensor pollicis longus, just pull your thumb up, Cynthia, pull it up hard against me. You'll notice it stands out there, and you'll notice that it goes through a dog leg. It swings around here around Lister's tubercle, a small bony protrudence on the back of the dorsal aspect of the distal radius. And then we go, so we've done first compartment, second compartment, third compartment, and sixth compartment with extensor carpi ulnaris. So we have 2 other compartments to do, and the largest compartment is in the middle here that contains the common extensors to all fingers, and also an extra tendon to the index finger. And the fifth, so that's the fourth compartment, has the common extensor to 4 fingers plus extensor indicis. And the fifth compartment contains 1 little tendon, extensor digiti minimi. So we have 1, 2, 3, 4, 5, 6 compartments containing 2 tendons, 2 tendons, 1 tendon, 2 tendons, 1 tendon, 1 tendon. The extensor mechanism for the 4 digits consists of a common extensor coming from the common extensor muscle, going to index, middle, ring and little fingers, plus there's an extra tendon on the ulnar side going to the index finger called extensor indicis, and on the ulnar side here there's an extra one going to the little finger called extensor digiti minimi. If you just turn your hand on its side, take your thumb out of the way. If Cynthia now extends fully and points with her index and her little fingers, point as hard as you can, you'll notice that these 2 fingers are in line with her metacarpals. That's because she's got an extra tendon extending those 2. Now make a fist again, point with the 2 tendon ones. The 2 central digits, you'll notice she can't make the pointing in line with the metacarpal because they're a common extensor. And she's pulling these down with the common extensor here and here. So you've got an extra tendon that allows you to point with your index. Could you just do it again? An extra tendon to point with your index and little fingers, extensor indicis and extensor digiti minimi. I hope this video has helped you understand and remember the anatomy of your own hand.